Hi, my name is Dr. Imankusumadirja. I'm from Indonesia. I want to Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good evening for everyone in Indonesia. And welcome back to my show, my talk show, Dentistry Talk with Imankusumadirja, with a lot of special guests, including this one. And first of all, I would like to introduce my special guest for tonight's show. It's Professor Giovanni Olivi. Buongiorno, Giovanni.
Buongiorno, buonasera. Good evening. Good evening.
Yeah. Good evening in my place. That's right. So before we start, I would like to introduce our special guest for tonight. Professor Giovanni Olivi is a professor and scientific coordinator of the Laser Dentistry Proficiency and Master course at Cattolic University of Rome, or Università Cattolica del Sacro, Cuore. And he's well known in the laser field, if I may say that, lecturing worldwide for laser education. And by the way, in 2002, if I'm not mistaken, he completed the postgraduate laser course at the University of Florence. I already memorized this, you know. And ISLD 2004 proficiency, advanced proficiency also from ALD, and master status from the ALD. And what I love is he's the author of over maybe 70 peer-reviewed articles, textbook. I also have his book, like Laser in Endodontics, Laser in Restorative Dentistry, and the only one I don't have is Pediatric Laser Dentistry. I haven't have it yet. Okay, so how is Italy, Giovanni?
Italy is very nice. It's very sunny now. It's quite better for COVID situation. The virus is quite under control. People is going to start to live regularly as in the past. I'm very optimistic for the future. I think that after this summer, most of people say that we will have a rebound, but I'm sure that we will be able to manage any problem, and we will go in the future to be well, to stay well, and to continue to live our life.
I'm glad to hear that, because what we heard from the news before at the early outbreak, Italy was, suffer a lot. After yes. China, Italy was suffering a lot.
Yeah. But fortunately now it's better.
It's sunny there, right?
Very sunny.
Very sunny. That's good. That's very good.
34 degrees.
34. Oh, it's almost the same as Indonesia. We have 32, 34, 36. That's nice. So is there a lot of people going to the 33 in Rome. Okay, nice. But by the way, I miss Rome. Okay, by the way, as someone says hi from Sudan.
Hi to all. Hi.
And we already have participants from, of course, Indonesia, and also from Australia, some from Philippines.
Oh, nice.
I would like to welcome Dr. Rosana from Philippines, and there's also from Malaysia. And we are happy to have Professor Olivi here in our show. By the way, before we talk about the topic for tonight is laser master program in laser dentistry, I would like to know some history from you, some story from you. And the first is, when was the first time you get involved with laser dentistry, and why? Why? There's a lot of people asking me the same question. Why?
And why? Nice question. I can say I work with my wife.
Okay.
My wife is a colleague. She works in the field of pediatric dentistry and orthodontics. And at the end of 1999, we start to have some interest in laser. So I got some machines, some demonstration, some small one-day course, some evening lecture. And so we understood that this technology, as we bought the first laser in 2000, so 20 years ago, exactly, it was June 2000. And we understood that the laser was the right instrument to change the millennium, to enter into a new era. And I think that I'm sure that our choice was very correct. The laser changed our professional life, changed a lot of the possibility to work better in our practice. And as this is a nice history, I think that many of us can tell a story about. And if the other dentist, the dentist is a great cake.
Yeah.
And we are just a very small
part. Yes.
I don't know if it's a 10% or 15% slice, but if the other really understand what the benefit can be from a laser, they will change rapidly their idea.
Their perspective, definitely. So, but do you think that laser can be like light cure in the past?
Light cure in the past.
Usually we place composite using a self-cure composite at that time.
Yeah. I think that laser can be like implant in the past.
Okay.
When I graduated in 1980 something, there was some people that talk about implants, and prosto on implants. It was something that we cannot understand how really it can work. Now implant is everyday practice, is a gold standard.
For replacing missing teeth.
Yes, it's something very predictable. And so I think that laser is not will be, is. Something that we need in our office. You can have one, you can have two, you can have three. But if you have a practice, you can.
Okay.
So you cannot work without a laser.
Yeah.
So do you have ultrasounds? Yes, I have.
Yeah.
Do you have panorex? Yes, I have. But it's much more easy and comfortable to work with the laser than to do a panorex. Maybe the patient can have a panorex on his, but the laser is everyday practice. It's every patient practice.
Yeah, but there's a lot of people said laser is just a tool. I mean, for me, it's different. It's the tool, right? It's the tool to do everything. But
yes, I heard you to talk about this. It's better to say is a tool.
The tool, right?
It's a tool, because the tool from the other side cannot give you well.
Yeah, of course.
So some strategy is better to use.
Okay.
It's a great tool. It's a great tool.
Okay, another question. Why did you choose endodontics?
I don't know, but I started as a pediatric dentist.
Oh, you're starting with a pediatric dentist. Okay.
Maybe the reason is that when I changed from pediatric dentistry to endo and restorative, because my wife is a pediatric dentist, and to have two pediatric dentists in one family is too much. It's because I met Professor Caitsas.
Yeah.
He was my mentor 35 years ago.
Wow.
And I like how he proposed the topic, how he teach the topic that is the same that he does now.
So we have the same mentor.
We have the same mentor. I always say it.
Okay.
That is an important topic as many other.
Okay. So I will have move to another question. So what do you think about nowadays? There's a growing enthusiasm in the field of laser dentistry, globally. So how do you see that?
Yes, it is a great excitement. Yes. The people have to understand that if we are not very well educated, we cannot drive the car correctly. If we have not a license to drive, we cannot drive safely. If we have not very good instructors, we cannot have the return of investment that we expect from a laser. So it's very important to study well, to do courses, to grow slowly, and the laser, the tool, will become the tool.
Okay. So I always have this question in my mind to ask you, but it doesn't haven't become a realization. I want to ask you, what is the story behind this Master of Science program in laser dentistry, and how is the story with the collaboration with Academy of Laser Dentistry from your point of view? What is the story?
My point of view, yes, this story is a difficult question. Difficult.
But this time I do the questioning. Well, everyone, I think all of the participants should know, he is my professor, and usually he asks me the question. Well, this time is one way around. This time I have the privilege to answer the question.
Okay.
Okay, please.
I graduated. I got my education from my LT, Academy of Laser Dentistry. I was quite satisfied about, but I found a lot of missing parts.
Okay.
Then I got my education from the Università. And I was very fortunate because in 2002, there was really a great enthusiasm. And my professors were Gutenet, Jean-Paul Rocca, Andreas Moritz, Professor Benedicenti, and many, some Italian. And so probably this here education course was the better way to arrive to know about laser. meeting a lot of great experts. Then I work in Genoa University from 2004. Genoa had a very good proficiency course for Italian, 1-year program. And slowly in 2008 or 2009, I proposed then to do a 2-year master course. And this was a great success immediately. We did 2009, 2010, 11, 12, 13, 14. Then in 2014, I left Genoa, and for a couple of years, I just worked in my clinic. And I decided that I had the maturity to do something from my experience that could be possibly better than what I did in the past. So mixing the course from private academies like Academy of Laser Dentistry or from Laser and Health Academy from Fotona, mixing this education together and at the university level, and so trying to meeting also Valida Tayeb or Manafa Ichka or other colleagues to put the best speakers, the best experts together in one group. And I think that really our group, we have the best teachers.
Yes, I think so. I experienced it by myself, by the way.
Yes, and not only, but this group is an opportunity to become teachers. First as a tutor, then as a speaker, then as a professor. Slowly, we can create something that is unique. Yes.
Okay. So there's a lot of different fields in dentistry, and some participants there's also a question. So will these master programs specifically cover all of the field in dentistry, and what are the goals of this master's program?
Yes, the goal is to try, we never stop to learn, never.
Yeah.
So when I prepare my program, and I already prepared the program for the next year, we always miss 1 week, 2 weeks, because I would like to invite Iman or another friend to put in the program their experience and their topic. So we can teach laser in all the fields. But what is important, if we are not able to touch all the fields, is to open the mind to understand the correct way to use our mind and our device. When we understood how to use the tool, how to drive the car, we can use the laser in pediatric dentistry, in orthodontics, in mucogingival surgery, in periodontics, in periimplantitis, in endodontics, in prosthodontics, in new therapies. You can use the laser for newborn with tongue tap.
Yeah, like Phillips stasis.
Yes, you can use the laser for anti-snoring. You can use the laser for facial
rejuvenation.
You can use the laser for a lot of things, including pain therapy, photobiomodulation, that in other field of medicine is used since 40 years. Because if you have a trauma, you always have the prescription to do 10 sessions of laser. Not here, but here on the foot or where you have the injury. So why do not use this tool in dentistry?
Yeah, it will be definitely very beneficial for our practice, especially. Yeah,
and I have to say that I learned a lot of things also from you, from my group. Yes, from my group. 12 persons that with their mission, with their proposal of work, introduced many new topics.
Wow, that was a huge compliment for the groups, I guess. I hope they're watching this.
Yeah.
Well,
you graduated with honor.
I don't mention that here.
Yeah. Yes, our host today, he graduated with honor.
Thank you. Grazie mille, Professor. Okay, so there's also a question from the participant.
Yes.
So what is the difference between this Master of Science program in the Unicatt, compared to other program? I know the answer, but they want to hear it from you.
You can give your answer, and then I give mine. Because I am your professor, I can.
You can do whatever you want.
Tell your point of view, and I will give my point of view.
Well, this program it's more like ALD program. It's more like a clinical science. It's not just theoretical like maybe the other programs like that. For me, it's more than just university program. It's more like a family. I never experienced this way. It's the bonding is so tight. I just it's more like a family than the university for me. That's my main reflection from this group. So what about your answer?
What about me? What about me is how I decide to put my university in the field of laser. Yes, it's a mix of theory and practice. But the practice with the hands, without the science.
That's right.
And on the other side, the science without hands is only theory. It's
useless. Yeah, it's only theory.
Absolutely. And because this is my point of view, since when I started dentistry, I always follow some science, reading science articles, and then applying. And so this is the way that I always follow. And this is why our lectures are theoretical based, but also very practical. Then I teach in many universities. I know almost all my colleagues that teach worldwide. And so I know what I like from one and what I don't like from one. So that I try to put together all the good things that I would like to give to my students, and that I know that the students would like to receive.
Yeah.
So it's good. I close the window because there is some noise from there.
Okay, no problem. Well, anyway, for the participant, if you have a question, you can also type in the chat column, and you can send it privately to me, or you can just write, and then I will ask the question to Professor Olivi. And for your information, by the way, there's this session is recorded, and if you haven't had the chance to hear what Professor Olivi already said in the first 10 minutes or the first 20 minutes, then I will post it in my YouTube, and you can watch it later. And also I will have another program. It's an open house for Academy of Laser Dentistry study club Indonesia for Southeast Asia. If you want to join us, then it will be a closed session, not open like this, and you can join me through you can register to the number to the phone number that you have by registering this show. So I'm going back to Lynn. Say hi, Dr. Lynn Lan from Australia, from Canberra. She said hello to you, Professor Olivi.
I respond.
Okay, so I would like to add something for what is the difference between this program and any other program. I mean, I also attend other program before this, and what is beneficial for me, what attached to me, is something that I learned in the class or in the session or in the module, say whatever it is. I can, implement it in my clinic immediately. I mean, theoretically, the training and what I do in my practice, I mean, it's instantly. I can implement it. So it's very beneficial. And the other question, so this is I want to know this secret recipe for how did you manage to build a strong unity and a friendship among the students in the program. I mean, we have like 13, I guess it's 13 of us, 12 or 13, right? Oh, from around the world, from Australia, from Indonesia, from Slovenia, from Poland, from England, from the Middle East. We have different countries, different nations. What is a secret recipe to build a very strong bond between the groups?
The secret is to put each of you the same enthusiasm that I put inside. If all of us work in the same direction, we will arrive to a goal. I always mention and I show a clip of the movie Gladiator.
Yeah.
I think the Gladiator, when he's inside the arena against lions, and they are only 3-4, and the lions are 10 lions. The gladiators say, if we stay together, we survive. And this is true. If we work together, we can create a group that not only will help us to survive, but will help us to melt together a very strong group that can change the way to teach, can change the way to stay together in friendship, without competition, without arrogance, without many things that sometimes we can find abroad around the world. So
yeah.
Just because me is like you, we are simple people that we like to stay well together.
Very nice, very nice. But that's the first thing. That's the one thing that I love from joining this Master of Science program, actually. So a lot of people also ask me, so is this master program difficult to? I mean, they say like, is it difficult if we join the program or something like that? When we is it difficult to learn? Because some of the people that ask me, they don't have basics in laser. So that's why the last week I interviewed Walid Al Sayeb to talk about the Academy of Laser Dentistry and something. What do you say about that?
Yeah, absolutely true. We want people that have an education. When you arrive after a fellowship from Academy of Laser Dentistry, that is a strong education, 16 days, a lot of hours. Or if you arrive from LAHA Institute, other 16 days education. You arrive to the master that you think to be very strong. Then you understand that there are a lot of things that you can manage differently. And this is the step that we slowly have to do. So the message is join the Academy of Laser Dentistry Indonesia or International Fellowship. Join LAHA Master if you are a Photona user. Join the courses that we recognize as good courses to have a basic education, and then it's very good. It's very good. The opportunity to talk one to another, to listen to these fantastic speakers that we have.
Okay. There's also a question from the participant. Well, they have already a laser device. So, what if the laser? I mean, this is something they say with another language, not English. Will they able to use the device if they join the program? I guess it's a little confusing question.
Yeah. So there is a practical. The question is, there is a practical part?
Yeah, I think so.
Yes. There is a practical part. Of course, not on the patient.
Yeah.
Because on the patient, you must be a master. If you are a master, you can work also on patients. So there is a possibility to test one machine or another, one brand or another brand. So if you want to buy an erbium, you can compare 2-3 different brands, and so you can give your choice. Then you can listen to the suggestion of your classmates, friends, and so yes, there is also this opportunity.
Hi, my name is Dr. Imankusumadirja. I'm from Indonesia. I want to